I was born and raised right here in this county. I literally left long enough to get a medical degree, and I did my postgraduate training in Northwest Arkansas and came straight home to take care of everyone I grew up with, so it means a lot to me. We're a critical access hospital that has approximately 15 bed licenses. We have our most patients in Atchison County, Holt County, and the western part of Nottoway County, and we cover the gamut. For a very small hospital, we're doing a lot of things. One of the things that you see in a small town when you are one of 2 or 3 physicians, your time during the day is very precious, and being able to get everything addressed during a visit when you're seeing somewhere between 40 and 50 patients a day is very difficult to do. We got to talking about public health, keeping the public healthy, those kinds of things. We transitioned into a strategy with annual wellness visits, and that allows a nurse specifically to talk to that patient under our guidance and review everything in the chart, review all of the family history, and review all of the medications once a year so that we're not missing anything.
Kathy started with us in 2019, Kathy, is that right? We really worked on things that were important to Kathy as an individual, as a person, help her be successful with some of those things so that then she could really prioritize her health. And she's done an amazing job of that.
They've been there for me when I needed it, when I was at my lowest. Well, I dealt with a lot of deep depression, and they were able to see my red flags. They offered me like Senior Life Solutions, which is another program that's just been awesome.
So I've been a nurse a little over 40 years, and working with the elderly population has always been my very favorite part. When you get to know how much it helps physically to boost the mental health, I just love my program because of that. Patients just really do change when they come to our program.
Kathy got her A1C under control. She started taking her thyroid medicine.
They helped me I lost 100 pounds with them behind me.
Welcome was
spurring me on.
Yeah, and just checking in and celebrating the wins. We started this kind of work because we were really focused on what it meant for our patients. We wanted to start talking about health, and we wanted to talk about wellness and prevention. And then it became so much more than just that. It became forming relationships with patients. It became changing the narrative of how we address that care on every single visit.
It also makes the community itself kind of participate with each other, because everyone talks about, did you get your annual wellness visit? I've heard that in the office before, and we more than quadrupled the number of patients that are getting to that annual wellness visit so we don't miss things.
The Aim for Excellence Award really for me means that all of this work that this team has committed to and the goals that we've set and exceeded, they recognize that it's important and it's valuable.
I mean, it literally defines what we're doing. We are aiming for excellence.